discuss about perception of a patient. What are we going to observe from their perception? So in that perception, we're going to see what is hallucination and what is illusion and what is depersonalization and what is derealization. So in that we're going to discuss about, we're going to ask the patient, how do you see, how do you feel right now? So what is your perception as such? So they will be explaining whether they're having any hallucinations like auditory, visual or tactile hallucination. If you have any of these symptoms, we have to note it down in our scoring sheet. So that will help us to identify their psychiatric illnesses in better manner. Next one, we're going to talk about the illusion. The illusions are, as we all know, that it's a misinterpretation of stimulus. So if they have an illusions, most of them might have illusions or may not have illusions. So, but it is important that we understand that we have to identify if they have illusions or not. The next one is depersonalization. Depersonalization is feeling detached from self itself. Actually, they're going to feel they are not attached to anything else. So they're going to detach themselves from the reality. So that's called depersonalization. The next one is derealization, feeling detached from the own environment. So they're not even realizing where they are. So from that point of view, we have to make sure that they are not having these kind of feelings. So perception need to be evaluated all the time. So once we evaluated perception, we have to score it on our scoring sheet to identify their perceptual disturbances with all the symptoms which we have discussed so far. Next one is we have to identify their cognitive level by assessing what is orientation, whether they are oriented to time. You can ask them by questions of what time is now, what is the day today, and all this stuff we can ask, and what is the year, and all these questions can be asked to evaluate their time orientation situation. If they're able to tell that, which is good. Otherwise, we have to make sure that they are being noted in that scoring sheet. Next one, we have to ask about the place. We have to ask them where they are and which part of the world they are living in. All these questions need to be asked according to their educational qualifications. Next one, to the person, to ask them who they are and who you are, and all the questions can be asked. If they are able to identify you and themselves, then they will answer accordingly and appropriately. Attention and concentration. We have to make sure that we are attentive to the patient. When we are doing that, we can assess their attention by whether they are attentive or not. When we are doing that one, we can see how far they are able to sustain their attention to the current situation. If they are able to sustain it for a longer period, which is good. If they are not able to do it, patients like psychosis, if they have a schizophrenia or any other psychosis with personality disorders, they can have a lot of problems maintaining attention to a current situation. And next one is concentration. We can ask them some questions like counting 10 to 1 backwards, or you can give them some calculations, or you can give them some multiplication or any other things that's going to help them in identifying their concentration. Next one is memory. We have to check a patient's memory by assessing the immediate, recent or remote memory. So you can ask questions like, what did you have for breakfast, or what did you have some special diet yesterday, or did you have any special diet yesterday? If they're able to tell within the time frame of 1 to 3 days, that can be assessed as immediate memory. Then if you go and ask them, in recent past, did you have anything to share to us, or you have anything to identify us? If they're able to identify, most of them will have some kind of remote memory or recent memory. Then the remote memory, we have to ask about the past life. If they have any past life that they can share it to you. Most of them will have a very intact remote memory. They will not have recent or immediate memory because they were not in touch with reality all the time. So that's why we have to check if they have all this memory intact or impaired. So most of them will have an impaired memory. Next one, abstract thinking and calculation. We can ask about any of the abstract thinking questions, which they will answer, which we can evaluate to see if they have any ability to do that abstract thinking or a calculation. Calculations, as I have mentioned before, you can give them simple calculations like multiplications of 10 and 10 and 10, 5 and 5, and all this stuff we can give to evaluate if they are able to do a calculation. Most of them might be able to do, some of them will not be able to do according to their cognitive ability. Next one is insight. So we have to identify if they have a full insight about themselves and their disease condition. This is, as you know, the insight is to be aware of the illness and need for treatment. Most of the patients who have got psychosis will be having lack of insight. That is very, very important point for identifying their psychotic conditions. If they have a lack of insight about a patient or about themselves or their condition or need for a treatment, so it's time to identify their diagnosis, which they have as lack of insight. The next one is judgment. If they have an ability to make safe and responsible judgments or decisions, that can be called as judgment. Most of them will be lacking doing a proper judgment, so we can mark them for psychosis also. The next one is understanding the consequences of action. So this is very important. If you have a logical thinking, or if you have thinking, safe thinking, or a safe judgment, you will know and you will understand the problems of the actions you are due and the consequences you're going to face if you do any action. So if you lack of insight, if you have a lack of insight, or if you have a lack of understanding about the society, then you will have a problem by understanding what are the consequences can happen for my actions. And realistic appraisal and of situation. Most of them will lack these also. As a psychosis patients, they will not be able to appraise anybody realistically. So with this, we can come to a conclusion for how to do a mental status examination for a patient who is suffering from any mental illness. With that score, we will be able to diagnose a patient who's got what problem, and we can give them a guidance to how to get treatment and give a proper care plan and follow up further. Thank you so much.